Okay, hello everybody. Welcome back to Diabetes University. Hopefully everyone is doing well today, and also hopefully everybody can hear me and see the screen there for today's presentation on foot care. We had to make somewhat of a last second pivot for today's talk. We did have podiatry scheduled to present some information on diabetes foot care, but unfortunately there was a last second change of schedule for the speaker. So I will be filling in and sharing some of the information that's very important to know about foot care, especially with diabetes. So that's why you may have noticed we did kind of a last second invite yesterday. So I do apologize for that, but by no means will that take away from overall what we want to reveal today. And that is, really making sure we're getting more attention to the feet. They're sometimes overlooked when we look at the grand scheme of all the things we maintain in our lives. And with diabetes, it's very important to pay close attention to what's going on in those feet, because small problems can become major issues if it's not caught in time. So what we'll do today is just review some of the details about that from information provided from the podiatry clinics here on campus, and then also let you ask some questions just like all of the other routines that we have been going through so far. So again, it's good to be back. My name is John Vredenberg. For those of you that are joining us for the very first time, I am a dietitian and diabetes educator in the employee wellness program in Jacksonville, Florida, but we also do serve clients in Gainesville too. So we're doing a lot of joint programming to try to broaden our reach. And by coming to you in the virtual setting, we can pretty much present anywhere. So if this is your first time taking part in Diabetes University, you have been magically added to our email list, and you'll see a variety of topics throughout the year. You really just attend whichever session might interest you, and it's really up to you to determine what that is. We do record everything. So if for some reason you can't make it on the third Thursday at noon, you'll find details about how to access the recording sent out to everyone who's registered on our listserv. We do ask that after every class that you watch or attend live, that you take a real brief post test. Not really meant to stump you per se, but really that's the best way for us to track attendance and participation. And for some of you that are on some of the Gator Care plans in Jacksonville and some of the other areas, by participating in 6 of these sessions every year or annually over the course of the year, you'll also get 100 points towards your wellness credits. So again, it's important to do that little post test. So I hope you will take advantage of that opportunity as well. So today, 3 big things to review. We're going to discuss some of the risk factors for diabetes related foot issues. And again, at any time, if you have a question or a concern, type it into the chat. I might not answer it immediately, but we will get to it at least at the very end. We're also going to look at some steps for selecting footwear, as well as what to do in terms of your daily foot inspections and how to care for your feet, as well as what are some of the more common do's and don'ts for foot care. So there are things that you'll learn with diabetes that you have to pay a little bit closer attention to as it relates to foot care compared to other populations. But we also want to have some fun, at least as much fun as remotely possible by staring at a PowerPoint. So I threw together some facts about our feet, and I didn't know a lot of these myself. So we're both learning them together here. But you have about 250,000 sweat glands in your feet, which is why they have that nice fragrance perhaps for you at the end of the day. Produce about a half a pint of sweat daily. We also have a lot of sensory activity going on our feet, actually more nerves per square centimeter than anywhere else in the body. But the other thing that I found fascinating is that the average foot has increased 2 shoe sizes since the 70s. And if you take a minute to think about that, one of the reasons is tied to the rate of weight gain that we're seeing over the past 40 to 50 years. So there's been a small evolutionary adjustment there in terms of the average foot size. So I found that pretty fascinating. Also very fascinating is, although many of us are probably sitting down right now, you're walking about 115,000 miles over the course of a lifetime. It's a lot of miles. I did not know that was the equivalent of circling the globe 4 times, but hey, there we are. So again, that's an average. It's not a challenge. I don't do that in 1 day, 1 year, or 1 decade. But again, giving attention to the fact that our feet carry a lot of us, obviously, no pun intended, but we also want to make sure that they get the attention they need. And there are some very startling facts about foot care and diabetes that I want to share with you. And I was mindful of the fact that many of you might be eating some lunch right now. So I did refrain from sharing some of the more graphic photos. So this is the only illustration that's even remotely bothersome in terms of what it looks like. But what we know with foot care and diabetes is that the foot ulcer, is a common condition with individuals with longstanding diabetes, and 85% of those lower leg amputations are preceded by the foot ulcer. So that's why today we'll talk about some things that need to be done to make sure this doesn't happen to you. And about a quarter of all hospital admissions for people with diabetes are due to some issues with their feet. And once there is an amputation, unfortunately, we do see a decrease in overall survival rates. So again, need to take very good care of those feet to make sure we're in a good position to be healthy and well too. And there's 2 main issues that appear to drive most diabetes foot problems. One of them is nerve damage. Okay, so nerve damage, also known as neuropathy. Many of you in the clinical setting are probably familiar with this. This is basically where the nerves are unable to transmit information to our brain. It can affect our ability to feel pain, movement. It can affect our balance. It can also affect other body functions, including our taste, our bladder control, our digestion, our sexual organs. All of these can be the result of neuropathy. The second issue that appears to lead to most diabetic foot problems are issues around circulation. So circulation can be a problem as a result of high blood pressure. It can be the problem as a result of inflammation, high blood cholesterol, but more often than not, high blood sugar, when we look at diabetes related foot issue, is one of the leading contributors. So when we look at the cycle of high blood sugar, so let's say you have a small sore on your foot. So if it were to get infected, that is going to increase your blood sugar. When your blood sugar level goes up, infections are slow to heal. So it's an endless cycle of trying to really get control of the blood sugar, which is why catching some of these small sores early before they get infected is very essential. Otherwise, you kind of almost have an endless cycle of this high blood sugar, increased risk of infection, poor healing, and the cycle goes on and on. So we want to pay very close attention to not just our feet, but also our daily blood sugar levels. And that's probably the biggest risk factor when we look at nerve damage. So if we say neuropathy is leading to some of our more common foot issues, the risk factors for that nerve damage, there's a lot of things, but blood sugar levels out of range is probably the leading driver of that. Weight can play a role. Our age can play a role too, as well as the duration of diabetes. So if you're an individual who's had diabetes for a long period of time, say 20 plus years or so, that also puts you at risk for nerve damage. Now, again, a risk factor doesn't predict that you absolutely will have this issue, but again, these are some things that we look at in the clinic setting where we're saying, okay, well, this client is going to need a little bit closer attention when we look at routine follow-up. And then, of course, besides high blood sugar, individuals with high blood pressure and high blood cholesterol are also at increased risk for nerve damage. So when we look at, if you forget everything else today and look at some of the attention to detail for foot care, remember, it's all about monitoring our blood sugar. So your physician will have specific guidelines on how frequently you should monitor. And for those of you that are new to the program, I'll share with you some potential advantages with discounted monitoring supplies. But the other thing just comes down to the feet, check, clean, protect. Boils it down to those three key parts: checking our feet, keeping them clean, making sure the skin is intact, and doing everything that we can to protect that skin barrier. Because once that skin barrier becomes injured, that's where our increased risk for infection occurs. And again, that's all what we're trying to do is get out there in front of it with prevention. Now, when we look at one of the best ways to prevent foot issues, it all starts with what we're putting on our feet. So when we look at footwear, there are certain types of footwear where it's strongly advised that persons with diabetes not take part in this. I'm not saying they are immediately going to cause an issue, but again, it's all about risk factors. So when we look at some of the footwear choices that can cause more problems, we see high heels at the top of the list. The problem there is you're just putting too much weight on the forefront. And again, you're going to see an increased risk for blisters. So again, trying to keep that skin intact, and blisters are going to make that very difficult. Those pointed shoes, so anything that's compressing your toes and pinching those toes, can negatively impact our circulation. So that's why those aren't recommended. Flip-flops. So again, this is a big beach time of the year, and flip-flops are a common staple in many beach bags. But the problem, and again, the risk for these is the fact that it's going to rub the skin between the toes and again, lead to potential skin breakdown. So again, I'm not saying that you have to go into your closet and throw all these shoes away, but pay very close attention to the length of time you're wearing them and pay very close attention to your feet after you do wear them. But again, it's strongly advised from pretty much all podiatrists that anyone with diabetes should really avoid those types of shoes, and especially those shoes that just flat out need to be retired. If there are more holes on the side of the shoe than in the one to put your foot in, chances are you're not getting the support you need. So you need to toss that shoe, and don't be afraid to go shoe shopping, which brings us to our next slide. When we talk about shoe shopping, there's some tips to consider. I think most of you by now, if you've been working in healthcare for a while and follow some of the basic physiology, especially in the feet, that the afternoon appears to be the best time to go shoe shopping, because that's when our feet are at their largest. And that's why you want to make sure that the shoe is going to fit the foot when it's at its largest. But you also should make sure you're selecting shoes based on how that shoe fits, not necessarily the size on the box. So size can vary quite a bit. So I know mentally you say, well, I'm a size 10, so this is a size 10, so this must work for me. And I just go by how it fits. And it should immediately feel comfortable. Okay, you shouldn't put on a shoe, walk around and, after I break it in a while, it should be just fine. No, don't do that. They should immediately feel comfortable, and make sure you're trying your shoes on with both of them on your feet. So I know sometimes we'll just put one on and kind of hop around on one foot awkwardly in the shoe store, but no, walk with both shoes on, make sure they feel right. The ball of your foot should be right there in the widest part of the shoe. You should have a little bit of wiggle room for your toes, generally agreed upon about 3/8 to a ½ inch. So as you stand up and you feel for your longest toe, make sure you have a little bit of a gap there. And again, make sure that when you are wearing it and doing that little test walk, that it's not riding up and down on your heel too, because that's going to indicate that it's just not a great fit. So again, a lot of care needs to go into what you're protecting your feet with, and then also the socks that you're choosing. So when we look at socks, I know a lot of times, especially us guys, we're paying a lot of attention to all the designs on the socks now, and there's some pretty elaborate ones out there. But in terms of overall diabetes care, it needs to be snug but not tight, as well as moisture wicking. So again, we're trying to preserve that skin barrier. A high degree of moisture is going to increase the risk of fungal infections, and what we're trying to do is just wick away some of that moisture. Remember, you got 250,000 sweat glands on your feet, so we need to do everything we can to wick moisture away from them. And it's also important to change them frequently. So when you get home after work or after playing in the yard or whatever it is, don't be afraid to take them off and put on some fresh, clean socks. And of course, some of the more obvious thing is to just check for holes and And looking at how they're constructed, it's generally recommended to avoid the seams because these can create some pressure points on your toe. But socks are constructed in so many different ways. It's really on a case-by-case basis. So if you're feeling a seam of a sock right around the toe bed, then that's something that you want to avoid, because once you put a shoe on, it can constrict it even further. You'll also notice when we look at selections for socks is that there are a lot of manufacturers that make specially made socks called diabetic socks. I never really liked that term before. Socks can't have diabetes, but the verbiage notwithstanding, diabetic socks typically are going to have those three things that are very important for diabetes related foot issues. And that is that they're moisture wicking. They typically have more cushioning at the bottom, and they're also constructed with a looser fitting elastic top, or even a very minimal amount of elastic. So those are some things to keep in mind, but especially the constriction. So you want to make sure that when you take the sock off, that you still can't see an outline around your legs. That's going to indicate that's a little too tight. So we're trying to not only just protect the skin integrity of our feet through our day-to-day activities, but we also want to do the best we can to promote regular circulation in our feet as well. Now, I'm going to go over some do's and don'ts for proper foot care. And again, if you have any questions along the way, just type them in the chat and we'll make sure we get those addressed. But one of the biggest things that you can do, and it's easy to do, but it's often overlooked. I myself sometimes am guilty of it too, but check your feet every day. And if it helps, set a time. So after your morning or evening shower or bath or whatever it is, check your feet. You're looking for cuts, you're looking for cracks, you're looking for sores, anything unusual. Use a mirror, just like in the picture there, to see the bottom of your feet and make sure you're getting everywhere. Look at the color. If you're sensing warmth or redness, that's an issue that needs to be investigated pretty quickly. So reach out to your doctor. But more importantly is making sure you're keeping them dry, especially between the toes. So we want to keep them dry to reduce the risk of fungal infections and those types of things that can occur. But you also want to try to keep them moisturized too. So it's kind of a slippery slope between the moisturization and the dryness. But applying a skin lotion really to the heels and the soles can prevent that drying, cracked skin. So it's another step that we can take to preserve the skin integrity of the foot. But it's also very important to make sure you're not applying the lotion between the toes, because again, that can promote moisture there as well. So again, I'm trying to keep the feet intact and clean, and making sure that we're looking to make sure there's nothing odd going on with those feet. It's also very important you pay attention to how you cut your nails. When we look at cutting our toenails, we want to trim them straight across. Sometimes it's easier if you do it after you shower or bathe. That helps soften the nails. But what we're trying to do here is prevent any ingrown toenails. So cutting them straight across using an emery board to soften the edges there, that's fine. Any cuts or scratches you want to clean with a mild soap and water, cover with a dressing. We already talked about the best time to buy your shoes later in the afternoon. But the other thing to be very careful with, this is especially important here in Florida, is to avoid the temptation of going barefoot. And you can avoid that temptation of going barefoot because that'll help you avoid that extreme heat. So not only are we looking at extreme heat in terms of sunburn on the tops of our feet, but also on the bottoms of our feet if we're stepping on a hot sidewalk or a hot pool deck or hot sand. So make sure you keep those feet covered at all times when you're inside and outside. So even wearing some simple socks can prevent you from inadvertently stepping on a thumbtack or a nail. I've got a toddler at home, so there's all kinds of dangerous items, not say dangerous, but all kinds of strange toys on our floor that we can inadvertently step on. So again, take care of what you're putting on your feet to protect them as you're walking around, not just outside, but also inside too. And it's also a good idea when we look at promoting circulation is to to keep those legs elevated when you're resting. So if you're at home sitting in your chair on the couch, try to keep those legs slightly elevated. If you want to invest in maybe even just a small footrest at work, that'll help a little bit. I mean, when we talk about elevating the legs, it's typically advised to get them above the heart to promote better circulation. That'd probably be an odd look in your office, but at least a small footrest during the day can help do a little bit more with circulation, as well as getting up and walking around. So if you can incorporate some walking and motion and movement, things that can get that blood circulating, that's always going to be a good thing, not just for foot care, but for circulation issues in general. And then anytime you need, advice or treatment, see a foot care specialist. The standard recommendation when we look at how often to see a podiatrist with diabetes, it's typically recommended you visit them at least once per year. So that should be a standard part of your annual assessments, besides seeing an eye doctor and your general practitioner. Get into the habit of seeing a foot care specialist at least on an annual basis, and he or she can advise you how often you might need to come back. So again, that foot care specialist will pay close attention to circulation issues. I might use what's called a monofilament test on the bottom of your foot to see if you can have, if you're noticing any loss of sensation, things that can indicate some early signs of nerve damage, and then take action from there. But usually once a year is the standard recommendation for how often to see a podiatrist. Some things you don't want to do. You don't want to take foot care into your own hands when it comes to treating corns and calluses. I know it's tempting to just get in there with a razor or scissors, but again, highly likely that you'll end up inadvertently cutting yourself and increase your risk for infection. So all we're trying to do here with most of these foot care tips is just minimize risk. See a doctor, a podiatrist, to get the attention needed for any type of corn or calluses. They might have some at-home advice that could advise you on, but again, you don't want to try to take matters into your own hands. They also aren't recommending that we use anything to over the counter for treating corns and warts. Because of these lack of sensation that might exist and you not know it, it's typically advised to not apply heat with a hot water bottle, not soak your feet. I talked about using lotion between your toes, trying to avoid that. We talked about not walking barefoot. But again, probably one of the best things to do is get up and get moving, and don't sit for long periods of time. So some of the do's and don'ts of foot care. And then when we're looking at this daily checking of our feet, remember, we're checking them every day. Set a time on your daily calendar for which to do that. Here's where you need to call your doctor. Okay, so there are certain things that you can, say, well, I'll monitor this on my own, it should be fine. But here are some issues that if you're noticing that these persist for a long period of time, you want to call your doctor. So we're talking about pain and cramping in your legs, so your lower extremities. If you're noticing tingling or burning sensations, that's an early sign of neuropathy, or that is a sign of neuropathy. So you'll want to contact your doctor. Any loss of touch or sensation, loss of hair, persistently dry and cracked skin, a change in the color and the temperature of your feet. And this one's something that can be very serious. So if you notice that your feet are feeling especially cold or have more of a blue or black tint to them, that's an emergency. Okay, so that is a potentially very serious blood flow problem. So you want to call your doctor immediately, and he or she may advise you to get to the hospital. Thickened yellow toenails, blisters, sores, especially sores that might be oozing or especially red or have discharge. Those are some things you want to contact your doctor about. And then the other thing to consider is that when we look at individuals that are on metformin, they tend to be at higher risk for B12 deficiency. And B12 deficiency can increase the risk for nerve damage. So next time you're at your annual checkup or regular checkup with your doctor and you're on metformin, ask he or she about B12 screening. They may already be doing it on your behalf, but it's a good idea to have it checked to see where your status is. So again, it doesn't happen to everybody on metformin, but there is somewhat of a higher risk profile for that particular group. And when we look at who to call, I listed some resources here on this presentation. Again, we'll send this out to everybody that's that's on our mailing list, but I pulled the contact details for both Jacksonville and Gainesville. So in Jacksonville, we have a specialized foot and ankle clinic at the North Hospital. And then in Gainesville, those services are housed under the UF Orthopedics and Sports Medicine Institute. So I've got your appointment details right there. So if you're a person with diabetes and you've never seen a podiatrist before, I'd recommend calling to get your appointment scheduled so he or she can kind of, make sure everything is moving in the right direction in terms of foot care. And as I said from the outset, besides checking and cleaning and protecting our feet, monitoring the blood sugar is very important. So everyone here that is on diabetes medication may have been given different guidance on how often to check blood sugar, and that's fine. We'll defer to your healthcare provider on how often you should check it. But if you're a Gator Care member, a Gator Care subscriber on the UF Health plan, you do qualify for the Contour Next meter as well as the Contour Next strips at no out-of-pocket costs. So it's an important detail because sometimes these out-of-pocket costs can add up. 30 to 40 bucks a month can really add up when we look at the cost of test strips. So we don't want that to be a barrier to care. So that's why we started this program a couple of years ago. So I would encourage you to take advantage of it if you're not already. If you need more details, you see the website on your screen, but just go to gatorcare.org. Under the diabetes tab, you'll find all the details on how to get started. If you have any problems or if something doesn't make sense about that whole program or any other logistical issues, I'm here to help too. So I've got my contact information on the screen. Of course, you got this invite, so you know how to reach me there too. But again, we want to make sure that we're getting you all the help that you need. And again, I think foot care is one of the things that can be often overlooked, but if it's overlooked and a problem happens, it can get out of hand really, really quickly. So that's why I always try to do my best to do that daily foot check just to see if everything's going okay. And I try to, take good care of my feet. One of the things that I didn't mention when we talk about shoe selection, and this is something that someone told me in a shoe store once. And again, I did some research on it, so I know they weren't just trying to get me to spend more money, but you'll notice some of the price differences in certain types of sneaker brands. Typically, the lower price versions of the same sneaker are made with less material and less ankle support. So you often get what you pay for in some of these sneaker selections. So pay close attention to that too. It may be worth spending the extra $10 to $20 for a little bit more support and a little bit more material and better overall coverage and protection. So make sure you try them both on, see if you can notice that difference. And sometimes you get what you pay for with shoes. And again, we don't want to sacrifice a few dollars and end up with some type of nasty injury. So that is the gist of what I wanted to cover today. So again, I do apologize for some of the late scheduling of this program. We had to kind of roll with the punches in healthcare, and sometimes our healthcare providers have other things that they've got to do. So we've got the basic information out to you, and next month we're going to talk about carbs. So we're going to take a look at some of the research on low carb diets. So there has been a lot of development recently about how much carbohydrate is actually beneficial for persons with diabetes. So several years ago, we thought, well, we just have 50 to 60% of our calories from carbs, then it'll be okay. Well, we're learning that might not be the case. So maybe getting a little bit closer to a lower amount of carbohydrate could have great impact on our blood sugar. So we'll talk about some of the research on low carb diets. I'm going to try to get a few other dietitians to join the panel discussion here too. So with that, I'll open it up to any questions, anything along the way that you want to learn more about, or any questions about today's talk, just type them in the chat. I'll be sticking around here to manage that. But again, until next time, we'll see you at Diabetes University. Take care.